can't care for somebody properly and completely unless we see that person as an individual, and everything we do for that person stems from them being at the centre of what we do. If we don't do that, we fail.
Person-centred approach is really at the heart of this tool, but also at the heart of good quality care and support for people living in care homes. And all of the other sections of this tool, in a way, kind of relate to this at its heart. There are lots of concrete things that can be done to skill people up who are working in care homes with the tools and approaches that they need to know to have good conversations with people and to plan well with people and review how things are going with them based on who they are and what's important to them.
I've been working in care for a long time, 20 plus years, and although person-centred care wasn't something we talked about 20 odd years ago, it was certainly something that there were a few of us, we were embracing it even then. And I will never forget a gentleman by the name of Guy Botwright that I looked after back in the 1990s. Elderly gentleman then, absolutely amazing man. He fought in the Battle of the Somme, and towards the end of his life, he had a very rough time, and he used to get underneath his bed. And sometimes the only way you could help him or make him feel safe was to get underneath there with him. And then he would come out, and we'd make him a cup of tea, go to the navvy and make a cup of tea, and just sit with him for a little while, and he would calm down and be fine again. But so person-centred care isn't a new thing. It was practiced years ago, we just didn't call it person-centred care. So it's something we should be thinking about, and thinking about our residents and putting them at the centre of everything we do every day.
Person-centred approaches are universally applicable, and that applies also to people who are non-verbal. And for people who are non-verbal, that's about finding ways to understand what they like and what they don't like, what their preferences are, from talking to people who know them really well, so their friends and family and people who work with them, and also picking up on non-verbal cues, so that using that information we can orientate the care and support around them in a way that is best going to fit what makes sense to them.
Treat people, individuals, like you would like to be treated yourself. Respect them, they are individuals, dignity, treat them like people, and take time with them, get to know them. That's what I would say, really.
It only takes one small, simple change to make a huge difference to such a lot of people's lives. So I'd really encourage commissioners and care home managers to have a look at the tool and see if there's anything in there that can help them to make a change that's really worthwhile to their residents.